Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
We always have formal articles that we can cover in the time we have. This is a subject that we have discussed a little bit for the last couple of weeks, how psychedelic drugs can help patients at different stages of life. And now they're finding more evidence that at the end of life, they can help you view life, the end of life, differently, more of a rosy perspective towards the end of life than many people have had in the past. And I think last week we talked about Molly and drugs like that in the past were frowned upon. Now are finding a place in life and sometimes in the end of life. Should you be rosy at the end of life? And the question should be, why not? If you're rosy at the beginning of life, why shouldn't you be at the end of life? What is more important, the beginning or the end? Of course, those are philosophical questions that are answered. Solomon said that the end is more important than the beginning, because it says a lot about what you've done with your life, rather than the promissory note of what you could do with your life. And so a lot of it depends on what you have actually done and what your living has been like. Many people are 80 and wish they could be 50 again. And many people who are 80 are grateful that they've lived to be 80, and they want to enjoy the rest of their lives and also prepare for death, because life and death are a cycle that one goes through in every phase of life ever since Eve bit the apple, right? So any comments about this article and the rosy perspective of at the end of life? Any comments about it?
Yeah, I got a comment. They're talking about psilocybin, and that's also known as magic mushrooms. Um, and let's see, right where the middle paragraph, the slide talks about adverse effects of psilocybin being nausea, vomiting, dry mouth, fatigue. Um, those were my experiences with magic mushrooms. So if I had the choice of end of life, I would probably much prefer edible cannabis.
Okay, all right. Any other thoughts that you want to share?
Yeah, I remember this movie came out in I guess it was the early 80s called Soylent Green, where
Yeah,
Edward
yeah,
G. Robinson was on his deathbed and they gave him LSD. And
yeah,
he had a very, very pleasant end as a
yeah,
result of it. I thought that was,
yeah. That's a good example of what uh, uh, what it looks like when you have those kinds of drugs. And the question is, do you need drugs to have that perspective? And that's an interesting thought. And
Yeah.
I think, and a lot of it depends upon the life you've led. You know.
Well, LSD is so strong that at end of life, I figure that it just take me out of there so quickly because it's so strong my body couldn't tolerate it.
Yeah, especially with your pure lifestyle.
I mean, I don't want you to give the wrong impression, have y'all thinking I'm a druggie, but I was young once.
Yeah. Okay. Any other anybody else want to share anything about their own perspectives of life and death, or what goes on in between?
they say it's the dash that matters, what's from what you do in between life and death. So I think if you do what you should be doing, the death is gonna be okay. I don't think you need anything.
Yeah, it's interesting. Solomon says that those who spend more time at funerals and mourning are better off than those who spend times in partying, because in many ways, partying you escape from life, and that when you spend time with funerals and those kinds of things, you reflect more in life, and you reflect more on how you can change and modify your lifestyle. But Solomon had some very interesting perspectives, although his behavior in life was a little different from his Ecclesiastes and Proverbs. But anyway, but he's allegedly the wisest man known to man, but yet his lifestyle was just the opposite.
Well, if you're lucky enough to live a pain free life and you just pass away peacefully in your sleep, that's wonderful. But if you're miserable at the end of life and need some palliative care, that's very important too to get that palliative care. Some of us have experienced loved ones pass away, like our parents, and, just months after months of excruciating pain. And getting some relief at the end of life can be very, very important.
Yeah, I think that's well stated. I remember my aunt who had ovarian cancer, who had a lot of agonizing pain and grief at the end of her life, and that kind of palliative care was not available then, but it is now, and as you say, it makes sense to take advantage of it. Okay, I think it's a subject for us to meditate on. Next one, please. This is a promissory note that we know that there's no, really so far, there's no cure for ovarian cancer. And so that the other end of the situation is to get a vaccine that prevents it in the first place. And that has not been done. And the people in Oxford got a grant for £600,000 to create a vaccine. It's more than a notion to do something with a disease that has a 10-year survival rate of 35%, but it's something that is worth working on. Well, whether it will be successful or not remains to be seen, but there's nothing wrong with trying. They are optimistic about it. As you know, most vaccines take years to develop anyway, and the COVID vaccine is a real phenomenon when it took less than a year to come up with, which has not happened before. So miracles still happen. So that's a positive hope, because right now the treatment for ovarian cancer is does not inspire a lot of hope. Next article, please. As we are identifying levels of cadmium and lead and other such things really affect the brain in a very negative fashion, particularly people of our hue, our complexion, and why we as people of color have more trouble with these heavy elements. We're not clear on, but it is pretty clear that lead and cadmium negatively impact the brain, and the less we have of those heavy metals, the better off we are. And interesting, in the newspaper just the other day, they come up with a law to eliminate all lead pipes within 10 years because lead has been so damaging, particularly to people. Similarly, cadmium is thought to have that same negative impact. And let's go to the next one.
I had a question, Doc. You know, the word plumbing comes from that word plumbum,
Mhm,
Latin word, which is lead.
mhm.
So, I mean, lead pipes have been around for centuries and centuries. So I'm just wondering why all of a sudden the focus is now put on lead in the pipes.
Well, because we're finding so much damage from lead, and I think it is late coming, but it may be overdue. We didn't know that lead was so damaging when we put together lead pipes, but we now recognize that lead has been associated with lowering cognition, uh, especially in youngsters. And so I think as we become more aware of it, we realize that we need to eliminate it. Of course, we're eliminating lead, but still other things that plastics and other things are taking its place in terms of poisoning. But I think that's a late recognition of something that we should have picked up decades ago.
And what's the major source of the cadmium?
And it's interesting because it doesn't really identify uh, the way in which the cadmium gets into our systems. But it's just has identified that cadmium is there. And that's why it's when they talk about decreasing, they aren't specific about what we can do to really uh, air pollution, talk about the water we drink. So those are the areas, but then we'd have to be sure to purify the water so we don't have so much cadmium in it. And there aren't those kind of steps that they're taking with lead that they're promising to take with cadmium, but haven't been very specific about it.
One thing I just highlighted was the one of the major sources is cigarette smoking.
Which we, of course, are trying to eliminate in our own fashion. It's interesting. You have more smoking in Europe than you do in the United States, but it's still a tremendous source of income for a number of people. And yes, there has been a reduction in cigarette smoking, but we still see a lot of it, unfortunately.
Dr. Callender, what do you think is worse for us, the lead, the calcium, and the lead, or the plastic?
That's
Because I'm thinking,
a, that's a that's a great question. Which is worse? I'm not sure because I think the negative effects of plastic we aren't really as aware of as we will be in the future. Right now, we are more concerned about the lead and cadmium, but I think down the road, the plastics that is everywhere may be may be more likely to be the cause of cancer. I guess the lead and the cadmium affect the brain and cognitive aspects, whereas the plastics causing more cancer, and we have more cancer now than we've ever had before. So I don't know the answer to that question, because
Awesome.
time will tell. But right now, the fear of plastics is all-consuming. But our efforts of finding efforts or ways of decreasing that seem to be awfully slim. So I don't know. I don't have a good answer for your question. This is a very, very provocative question. Anybody else have any thoughts or ideas? Darryl?
Well, yeah, it's kind of like saying who has a stronger bite, the pit bull or the Rottweiler. But, I guess we'll find out, or like you said, over time.
Yeah. Mm.
It's a toss up. Okay.
This is interesting because the flavonoids that they're talking about are the substances that are not processed. And we all along had said that non-alcoholic fatty liver disease was incurable, and that we had treated it with decreasing the fat intake and controlling diabetes. Now we're finding out that these flavonoid foods that 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 we've been eating for quite a while, but I didn't recognize it, actually have the capacity to actually decrease the risk for non-alcoholic fatty liver disease. And so the question is, how do we do that? And how do we eat more flavonoids? And this is something that I guess when you talk about the antioxidants, actually are the compounds that have the flavonoids. And then the vegetarians and the people who don't eat a lot of meat and who take flavonoid-rich foods, we're talking about fruits and vegetables, are the ones who are less likely to have this kind of non-alcoholic fatty liver disease, which is likely to become one of the most common causes of liver failure since we've eliminated hepatitis C. Because now alcohol, as well as NAFLO, are becoming the commonest source of liver cancer and liver failure. It seems that
The
almost
foods,
everything that we do emphasizes the importance of fruits and vegetables and the dangers of processed foods. Down?
the foods highest in flavonoids would be black tea, followed by onions, followed by parsley, but it does include things like tea, fruit, vegetables, grains, legumes, nuts, and wine.
Any additional comment you want to share? Well, it's interesting. As we go, we learn more and more why people are staying away from meat products and processed foods. Next article, please. This is something that is a reason why you need to get the flu shots, COVID shots, because you get some of these viruses, they can trigger long COVID relapses, and you don't need that. COVID relapses, long COVID is very undesirable, to say the least. and it can affect almost every organ in the body. And so you want to do anything other than have reactivation of viruses. We know what can happen with shingles and chickenpox, and so reactivating any virus is an undesirable element. And so it's in the best interest to get the vaccinations that prevent these diseases rather than to get reactivation of viruses that you already have. It's interesting that still we don't have a real surge of people taking vaccines as the flu season is coming upon us next month. There's not a surge of people getting vaccines. I know when I go to get my vaccine, there's not a long line. So it's a short line, as a matter of fact. And you wonder, are people taking the flu season seriously?
Dr. Callender, I just got my flu shot on Tuesday, and no symptoms as a result at all.
How about was there a line for you?
No line, zero.
Yeah.
I had an appointment, but excuse me, they also took my blood pressure, and it was 130, I think, over 60 or something like that.
Mhm.
Yeah. They brought me in for my blood pressure check because it was higher, and they said, "Well, you're here, you might as well get your flu shot."
Oh, that's
I asked them about the COVID, but I've already had 6 COVID vaccinations. For some reason, the nurse said that for me, since I had the booster, another COVID vaccination would be optional.
when did you last have your COVID?
I think it was May. I'm not positive. I have to check.
Because anytime after 3 months, you can get it done. Before 3 months is not advisable, but anytime after three months uh, is recommended.
Okay, thanks. I'll let them know.
This is an article that talks about COVID myocarditis, and this is one of the reasons why some people fear the COVID vaccine, because this has been one of the side effects of the COVID is that some people have developed COVID myocarditis, which has been short term for some, but for others it hasn't been. So some people think of COVID myocarditis as deadly as the myocarditis that exists, which is a concern, and also as a reason why some people don't take the COVID-19 vaccine. But the percentage of people who get that myocarditis, as you can see in this graphic, is certainly different from the consequences of the myocarditis that people get. Actually, the rare myocarditis that actually is associated with mortality and sometimes can be treated by heart transplant is not something that you want to get at all. And as we look at the reasons why people get heart transplants, the myocardiopathy is probably the number one cause. With the damage done by heart attacks is probably second to that. But the viral myocarditis is more associated with death than is the COVID myocarditis. But as we get into an era in which vaccines and their prevention becomes important, those people who don't get vaccinated use this as a reason not to get the different vaccines.
I don't normally ask people whether they're Republican or Democrat, but after looking at that chart, I think I'll ask everybody if they're Democrat
That's interesting, isn't it?
before I hang out with them.
That's interesting. How politics plays a role in so many different things.
Or
You
yeah,
know,
really, it's the dogma that gets passed down from the from those political leaders.
yeah, yeah.
I want to go back to that chart though. That to me, this is unbelievable. I've never seen anything like this. But I believe this, but now it's in writing. It's a fact.
But that it's kind of shocking, shocking. It's shocking how important our leaders are. That's it. That's what it says. Wow. We don't necessarily go by the facts. We go by a lot about what our leaders tell us to do, I guess. And this is an article about updated COVID vaccines. You should get them and when. And it talks about the fact that at least 3 months after the last dose of any COVID vaccine or 3 months after getting COVID. And the real thing is that if you had COVID, then you have immunity that's there, but it's short lasting. But with the vaccine, you have a longer lasting, we say. I think most of us have had at least 6 COVID vaccines, and some of us still get COVID after all of those vaccines. But be reminded that the purpose of the vaccine is to prevent hospitalization and death, and that's the real.
hospital, but they didn't give him anything. They just said go home. And I was wondering, I thought that if you checked in and the hospital, said you had COVID because they indicated that they did more than the rapid test, that they gave you what's the drug Plaxix or whatever the name of that other drug.
Paxlovid.
Yeah, but they gave him nothing, just told him go home.
How old is he?
He is 73.
Well, you got to understand that there are reasons why you can't take that drug. If you have any, if you're on certain cardiac medications, or if you have any kidney failure, if you have other things,
Mm-hmm.
there are good reasons why everybody can't take that medication. So
Oh,
it may well be that he may have had one of those reasons.
There's also another reason, Doc. If you go to the hospital too late after your symptoms appear,
Right.
they won't give it to you.
That's correct. Yeah.
You have to be within the first 2 or 3 days at most of symptoms.
Right.
Oh, okay. He was well past that. He was
Okay.
well past that. Yes. Okay.
Yeah, so
Thank you.
that may have been the reason.
There's more.
Yeah,
Um,
the one thing about the new variant that is hopeful is that the updated vaccines can cover the new variants, whereas the older vaccine uh, does not cover the 3 new COVID variants. And so that's why the updated COVID shot is recommended for those who have gotten past the 3 to 6 month period after having COVID, because of the new variants, which 3 new variants which exist that the other vaccine did not cover. It's interesting they talk about the COVID tests that, and I think Janice Stevenson that made a comment that she'd ordered tests. One of the things that was interesting is that some of the tests that you can get now have a price associated with them,
Yeah.
whereas in the past they were free.
Dr. Callender, what's the life of a testing kit, or does it matter?
Well, it's interesting. That was addressed as well in one of the articles, and they
Yeah.
said that the lifespan is thought to be a year or so, but that many of the tests could be used beyond that period of time. But they were vague about how long after, but they did say that. Betty had a comment or a question?
Yeah, comment. I heard John say that he had had 6 shots. I thought I had had more. So I looked at my record, and the one my husband and I got last week, that was our 8th shot. Oh, starting back in 2021.
Yeah.
So
Yeah.
every time they say get one, we've got one.
Yeah. Wow. Amazing.
Also wanted to comment about having a vaccination and still catching COVID. My symptoms were not even as bad as a cold. I had a slight cough and a little bit of nasal congestion. That was it.
Yeah, that's the advantage of the vaccine. Yeah. Okay, let's go to the next one. It's early. It's early, and one of the things that they look at is what is the impact of the flu shot in Europe or in Australia, and they identified that the flu shot was only 35% effective in Australia. So, what does that mean for us? I don't know, but it's just food for thought that sometimes the flu shot is 50% effective. Sometimes it's less. So we have to see. For the COVID shot, it's it's interesting that most of the 75,000 people who died last year from COVID were among those people who were not vaccinated, so it's certainly true that the COVID vaccination has been able to minimize the amount of hospitalizations and deaths that occur in people who are vaccinated. So it's good. It's interesting. Most of the flu season starts in November and ends around April. So it's going to be interesting what happens starting November, and whether the effectiveness of the vaccines of the flu vaccines and the COVID vaccines will be as good as they have been in the past. And one of the things that we also will reflect on is whether or not the mRNA vaccine uh, is as effective as or is more effective than the old vaccine, which was not mRNA. So with time, we'll be able to look back and reflect and see whether this is a giant step forward or not.
There's more.
This is the article that talks about who should be getting the coronavirus testing, and of course, people over 65 fall into the category. Immunocompromised patients, people with respiratory, cardiovascular disease, kidney disease, liver diseases, neurological diseases, and obese patients. This is something that was very prevalent with COVID. And then, of course, the new variants that we mentioned, the 3 new variants that have been detected. And this is the article they talk about the timing of the tests, and they were a little vague on how long you could use it, and they did mention that the tests now are cost that you have to pay for them, and that the expired test, this addresses the question that Janice asked. They were kind of vague on that. If it says the expiration is past, they can still be used, but it didn't say how long. And so if it says expired, it's up to you to decide whether you want to use it or not. But it's desirable to have a test that has not expired. But you notice it doesn't say, says they still can be used, but it doesn't say how long. Yeah. And of course, the gold standard is still the PCR test. Yeah.
There's more.
Yeah, and I think that pretty much reflects some of the things they've already said. Right. And this is a good reason why the vaccine is so important. And it goes into detail, give you the data that shows that the vaccine works. And the last paragraph is, go down to the last paragraph. Yeah, that really tells the story. And those of us who are in the senior group, over 65 years, are the group that needs it the most, in addition to the ones that they already mentioned. This is an interesting article on Meniere's disease because this is a disease that we don't talk about very much, but it's a situation where you have vertigo, hearing loss, and tinnitus. Janice knows much about this because her son had this syndrome. And as she knows and we know, it's virtually untreatable. They have a lot of things that they do, but sometimes they work. Most often they don't. And it's something that those of you who've had tinnitus for a long time or for a brief time can imagine how troubling that can be. But when you have it when it doesn't go away at all, you can imagine how that affects you mentally as well as physically. And the hearing loss is one problem, then the tinnitus is another. And then the fact that there are many treatments. The more treatments you have for a disease, the less likely it is treatable. So for this, you have a variety of things to do, but not too many of them are effective. But these are some of the things that they request. And the one thing that is clear, you need a hearing aid so you can hear, of course. It's interesting, in some patients get better, and then some patients do not get better. And what's the difference? I'm not sure. I know the difference. But I think it's important to go to places where they have experience in treating patients who have this tinnitus and hearing loss and vertigo. Probably those with the most experience. Janice, any thoughts or comments about it?
I would like to say, or I will say, Chris is doing well. It was very traumatic when it first occurred. He has Meniere's disease. He lost his hearing. He has and still have tinnitus, and vertigo was horrible. However, I want to say he's doing well, but now Dr. Callender, he wears 2 hearing aids. He had some hearing loss in his other ear, but he's doing well. He's doing well, and he's still being treated. And to make him feel better about it, someone mentioned a second opinion, which I believe in second opinions, and he got one by going to a special clinic in Boston. And they were very much in agreement with his treatment. They told him he had the best hearing aid at that time. Chris is ex-military, and VA got him his first hearing aid. And he's doing well. Chris is a very active, rambunctious, outgoing person. So he's not going to let that get him down. I'll tease him about it every now and then because he might walk around without it. Sometimes I think he does it for a reason, me, and I'll pretend with the sign language, which isn't a sign language, but he's doing well. He's doing well.
That's good to hear.
The main thing is the vertigo. When it first occurred, vertigo, how do you deal with that when you don't know what's happening? So that is much better. But he said the tinnitus is constant, but he's gotten used to it.
It's amazing because it's hard to imagine how you can get used to tinnitus.
Yeah. Mm-hmm. You have to live with it.
If you've ever had it,
you have to live with it. Yeah.
It's not fun.
No.
Okay. This is interesting because those of us who have hearing problems have learned how to read an audiogram. And you see what the normal is, and you see where your hearing is. And most of us who have hearing, we're below that bar, well below that bar. But with the hearing aid, you get up to the bar, and that's what is critical. And the audiologist will share that with you so that you can see exactly what is happening and how your hearing aid is helping you to hear the sounds that you wouldn't otherwise hear. Now, one of the problems, I think, one of the things that concerns me is those people who just go get a hearing aid, don't have an audiologist to guide them or help them. And it's somewhat less than ideal, because I think the hearing loss should be monitored to find out whether or not the hearing aid is doing the job. And that's what an audiogram will tell you. And now we have a variety of hearing aids, but I still think having somebody to go to look at the audiogram and see how your hearing loss is overcome by the hearing aid, it becomes important. Unilateral hearing loss is something that can occur, as Janice mentioned. At first, the hearing loss was on one side, and then it went to the other side. As you age, as John Buchanan talked about, how his music impacted his hearing. Many of us have the symmetrical hearing loss. Darryl?
Yeah, I've got the asymmetrical hearing loss and with hearing aids, and it's important to be tested. Get your hearing tested every 2 years. Most audiologists give you free tests, and if you have hearing aids, your hearing aids can be adjusted with hearing changes in your ears over a course of time.
Thank you for sharing. Any other comments?
Yeah, I've been seeing these tests for many, many, many years, but I never learned how to read them until looking at this article. And also, the hearing loss itself, like I said, was caused by standing 1 foot from one of the best drummers in the world for about 10 years. And, with no earplugs. Now I have to use earplugs when I play, but I definitely need a hearing aid, and I don't want to spend $4,000 or $5,000 for a hearing aid. And seems like every commercial's got hearing aids on them. And they say, okay, this is the best German hearing aid, and it only costs $200. So I'm hearing what Darryl just said. The best hearing aids, you can adjust them. The ones you buy for $200 are set, and that's it. There's no support that comes with them. But it's very challenging to figure out which way to go.
Well, not necessarily. Some of the cheaper hearing aids, like you can get at Costco, they have hearing specialists that can adjust those as well. Some of the cheaper ones, but it is true that for quality, you get what you pay for. So you're never going to get the hearing improvement with a cheap hearing aid. The advertisements try to convince you that the cheap hearing aids can be equivalent to a more expensive one. But generally, if you want a good set of hearing aids, especially for a musician, where you can hear conversation and music, you're going to have to spend three, four, maybe $5,000. There's just no way around it. You may want to go cheap, but you will get what you pay for.
Yeah, I use on the stage, I use in-ear monitors, and you can get real cheap ones. $120 is the one that comes with the system. When you get the custom made ones, they might run up into the thousands as well. So your point is well taken. Absolutely well taken. Thank you.
Well, if it's really well taken, sometime in the near future, you'll be proudly reporting to the group session that you now have some expensive hearing aids.
Yeah, well, I've got years of experience. Dr. Perez, good to see you again.
I thought the high cost of the hearing aid was the audiologists and the medical professionals that are
No,
associated with it.
no, no, no. It's interesting that you would say that because the hearing aid is the most expensive part of it. The audiologist that goes along with it, to me, I thought was the cheapest part of it. But they do go hand in hand. But the hearing aid, the quality of the hearing aid is the bigger cost item.
My mom has a hearing aid that she got from Costco, and she goes in there like every maybe 3 months, and they do a monitoring, and all that's included in their prices. So they can give you a free test, and then if you need a hearing aid, and I think theirs run between $3,000. And she goes in, when sometimes she can't hear, I tell them to go back in for adjustments, and they do the adjustments free.
Yeah. Thing about Costco is generally their stock is not current hearing aids. In other words, like whatever model, Onyx, or there's several other models. You buy them at Costco, you're getting something that was put out by the manufacturer 3 or 4 years ago. You're not getting the most current stuff. And at Costco, they don't have audiologists. They just have hearing specialists. So um, you go to a hearing center with an audiologist, you're getting more professional care on the programming and adjusting of your hearing aid.
True. That you're right. They're not an audiologist. They've had training, look at the equipment, and they can kind of monitor your hearing aid, and so you're correct.
What is also interesting that is not captured in this one, perhaps, is the fact that over the age of 70, close to 60% of the men have hearing loss, that they don't acknowledge it for a number of factors. Probably one of the biggest one is ego, but that doesn't mean that they can hear. It just means that they don't admit to it.
Cheap hearing aids is the number one reason why people walk around without their hearing aids in, because the sound coming out of those cheap ones is not good. It's not appealing to the person wearing that cheap stuff, and so they put them in when they need to hear conversation. But if you have good hearing aids, you love them, you love the sound. You pop them in when you wake up in the morning, you take them out before you go to bed at night. You want to wear them all day long.
Two comments. The previous article said you can take an online hearing test just by clicking that link. So if you go back to that previous one, which I closed out already, you can actually take one, and you can use the chart reader to understand the results of your audiogram. Also, this article is talking about recent results. There's a if you click on this, you can actually hear the article, hear the report. It's a video, I think. So even though we can't do it here, you can, when you're on your computer, you can click that and listen to the video.
Yeah, that's a good first step to take the online hearing test. I took one before I got hearing aids and found out that my hearing was 50% loss in both ears. And I even use that online hearing test to program my AirPods, and I use them as temporary hearing aids. Which, I was kind of amazed that with the AirPods, I could understand conversation. And I was missing a lot of conversation with my hearing loss. But even the AirPods, they do not sound nearly as good as the hearing aids that I have programmed by the audiologist.
Okay, I have another question for you, Darryl. So you know what I'm talking about, in-ear monitors.
Right.
You can't use them at the same time as the hearing aid, right?
No, you can't.
So have you used them? Do you take your hearing aid out on the gig, and then when when the gig is over, you put your hearing aid back in?
Yeah. Well, as a matter of fact, I take them out while I'm playing. When I go on break, I take out my in ears and I put the hearing aids back in just
This
so
is
I can hear conversation.
that is really something. Thank exactly what I wanted to hear. Thanks.
Okay, I have a question for both of the musicians that are active. Um, do you ever warn your band players that they might need to get hearing, because they teach it in textbooks in high school, secondary music appreciation, that a certain percentage of musicians, that's one of the hazards of being a musician playing in a band, of hearing loss, and it starts early, even as 40 years old. Do you ever tell your band members that they probably won't listen to you anyway, but do you ever encourage them to get their hearing checked out just because of the type of music? And like you said, John Buchanan, when you're with drums behind, and sometimes, I've been in certain churches and now they put the drums in cages and everything like that. And instead of using acoustic, they rather have the acoustic drums rather than electronic drums and tone them down. And how do you warn church people that are near the drums that are singing, and your band members that are in loud music, especially if they have a wind instrument playing right there in their ears? Can you warn them?
Yeah, it's kind of ironic. Sometimes it seems like it goes in one ear and out the other.
Well,
When you warn somebody about those things, but definitely it should be a part of training. Also, this this is something else. Those speakers at some of these live venues are so big and powerful. They could actually, with the right pulse, they could actually counteract your heartbeat and cause a heart attack because of that. The power of that beat can actually cause a heart attack. So, I mean, that's worse than your ears. But anyway, yeah, audio information is very important these days.
well, in my circle, my regular drummer wears hearing aids. There's a singer I work with that wears hearing aids. And none of us are shy about telling other musicians that you need to get hearing aids.
Okay, sounds like a good service. Thank you for sharing. Okay. This is a article that talks about the importance of autonomy in people who have cognitive impairments. Uh, uh, One of the most important ethical principles is the right of a person to make a decision on their own merits. And this becomes complex when you have somebody who is impaired. And if they have an intellectual disability, how do you get them to make an informed consent? And this is something that it causes all ethicists to have nightmares in many ways, because if somebody is disabled, intellectually disabled, how can they make an informed decision? And this is something that has plagued everyone. And one of the things, for example, that comes up is when you have children who are under 12 and you get them to give affirmation to what's going on. But that's different from somebody who is intellectually disabled. And how do you get them to give consent? And so this is something that requires a lot of training. And this is what this article is all about, is about how do you deal with people who are considered legally incompetent and yet try to get them to give informed consent. And that's it's more than a notion. And this is something that decision making is more than a notion. And it's something that we discuss in our ethical discussions and the dilemmas. And we often, therefore, have people identified as guardians of people who are intellectually incompetent. And the question is, how do you balance the autonomy of somebody who's intellectually disabled? You teachers, how do you handle that? Dr. Perez?
The question has come up about voting. And someone who is intellectually impaired and their right to vote. I know it's come up quite a bit, and the ethical issue is one that we need to be, when I say we have to look into biases that exist that have nothing to do with the incompetence, so that they're not blurred. It was a significant issue for adolescents and reproductive health care and decisions like that. So it's really important that we stress the importance of having ethical conversations and influence, especially with, in my case, with adolescents. It's a big issue.
Yeah, and how do you reconcile that? That's the question of the day, and somebody who, as you mentioned, for the adolescents, because you're talking about people who are under 18 and they don't have the right to make decisions, but yet they do in many ways. So that it's a tightrope that you have to, because autonomy is one of the most important aspects of humankind. And when you take that away, it's more than a notion. And the ethics of that is something that has been discussed time after time, and doing the right thing under those circumstances. And the comment you make about having people who are free of biases, I don't know anybody who's free of biases, so it becomes an interesting dilemma. Any other comments on some of you teachers have to deal with that all the time? Any thoughts on that?
I think the whole thing is ludicrous. When you're talking about giving everybody their rights to make the decision, and we all know people, well, no matter what stage in their life, and we're all are not equal. I mean, just like the example the other day, when one of our political leaders said that one particular political party was responsible for the hurricanes and etc. Then there's a group of people that believe that. In our society, we're trying to treat everyone as if they are equal. We no longer give IQ tests. We know that some people are mentally retarded. And then you get to the older population of someone that has dementia or Alzheimer's and not able to make correct decisions. And you know that. You have a 13-year-old child and saying because of their age, they can make the right decision about their bodies and etc. Somehow our society is just going over that we're in this downward slope of killing ourselves, which giving everybody their right to kill themselves. And doctors, there's no way, unless you just going around and say, put a label on everybody, mentally ill, cannot make a decision, correct decision in this thing. There's no way we can get around it. I don't see about making bad decisions. Who has the right? Some decisions are bad because that means death. But then you got to go and decide it. We have even educated doctors that are making bad decisions. So this is one of those questions that you'll be going around forever and ever trying to answer. And I don't see there's any answer for it, period.
Well, ethicists would disagree. They would say that you have to try to balance all of those things and then make the right decision. Your implication is that you can't make the right decision. Ethicists would say that, yeah, you can, but you have to try to eliminate your biases and try to do the thing that is in the best interest of the person involved. Dr. Perez, you had a comment.
And I guess it's where the word equity would come in, because it's going to be more expensive. It's going to be more comprehensive to inform somebody who has intellectual limitations. So we as humans have to appreciate those differences and compensate for them. Americans with Disability Act, which then made it more expensive for commercial buildings access, because we believe in autonomy. So it's something that we do believe in. It's something, when we look at equity as opposed to equality, we as a society have developed to that point that we do want everybody to be at the table. And in order to do that, we have to compensate.
Thank you for that perspective. That's a very important perspective to have, because if you really believe that you can minimize your biases and try to put yourself in the other person's shoes and allow them to express themselves in their own fashion and do what's in their best interest and what you think they want to have done. It's a balance, and it's a balance that is not easy, but it's a balance that tries to bring equity into the situation. And that's quite a notion, by the way, to do that.
Dr. Callender, do you know anybody, or give me the definition of biases? Do you know anybody that doesn't have a bias?
No. That's why I said minimize.
How do you minimize something? I mean, how do you minimize a bias?
Oh, to me, that's kind of easy. You try to put yourself in the other person's shoes. You put yourself in other person's shoes as close as you can. We're only human, as you pointed out, and so we do have difficulties. Mark, you had a comment to make.
Yeah, exposure. You know, the more you expose and diversify your social environment and social interactions, education is another thing, informing yourself of different cultures, different ways of thinking, and that's a way, it's a slow way, but it's a way to try to minimize your biases.
Darryl?
I think it's very, very important.
Darryl, let's get down first, then Dr. Perez.
Yeah. Biases are roaches. They don't like light. And so the more light you shed on biases, which would be education, the more the biases go away. But Carol made a point earlier. She was saying, well, are we ever going to get any smarter? Or we're going to be plagued by our biases where we make bad decisions all the time? And there's a historical philosophy based on that. Okay, we make decisions on biases because of self-governance, and our self-governance model is representative democracy. So you have people like Socrates, whose student was Plato, and Plato's student was Aristotle. They said that basically they said that people are not smart enough to self-govern, that they make bad decisions, they listen to the loudest voices, and that's their primary cause of making bad decisions. And they said a much better form of government was a council of wise men or a council of Solons, where your decisions for governance were coming from people who were wise, who were not motivated by political situations or wealth, like that's the motivation for oligarchies, that these people were trained to um, to know history, and their decisions were based on the best interests of the people. So this was the Council of Solons, which has been some historical societies and civilizations have been governed by Solons, but this was their most performed form of government, whereas either democracy or representative democracies were further down the line as far as effective and preferred forms of government.
Dr. Perez?
I think everything has been said. The Electoral College was based on that. And it looks like that's something that, given our society's access to information, prior to what do they call it? Alternative facts, misinformation. We're at that point now, where we have to, as a society, begin to look at those guardrails that were put in place that are no longer appropriate.
I don't know if everybody saw Mark's comment. Did you want to make that, share that, Mark?
No, it almost speaks for itself. If you, and this was piggybacking off of Darryl's historical comment about putting people together. If a person is smart by themselves, but if you lump a bunch of people together, our collective IQ goes down. And that's just a theory though.
That's an interesting comment, although there are many studies that suggest that when you put divergent people together, the collective IQ goes up. But it's a lot of variations on the thought on that. And the whole concept of diversity is that when you have diversities of thought, that you actually get better decisions. But anyway, it's a lot of different perspectives on each element. But I think the beauty of these conversations is that you have a lot of different opinions on the same subject with a different consequence on each of them. I recognize the intelligence of all of them, but I still think that of all of the governments, democracy probably is the better. But that's everybody has their own opinion, and that's the beauty of everybody having an opinion. But we've had a diversity of comments on this. Any final statements?
Dr. Callender, this is real life. In education, in DC public schools, they had a council to guide on what curriculum, how the money is going to be spent. On this committee included the custodial staff, the parent, the teacher, the principal, and some community representative that was out in the neighborhood. One, I thought this was ludicrous because only a certain ones of them were actually trained on what a curriculum should even look like. But then they had all these other people, and I've forgotten, John Buchanan, he was in the DC public schools, and he could say, and so can John, what this council was made up of. But they got the collective of these people to guide a school on what subjects should be taught, how the money should be spent, what teachers to hire, and how to spend the supply. First of all, you have a custodian, and they call them, the building engineers. Then you'll probably have a grocery store person who knows how to run a grocery store. You have a parent, doesn't necessarily, they know how their child is, but how do they know what subjects should be there? That collective bargaining, it soon went out, but everybody thought it was a great idea. They all come together to run a certain school. And you could tell by that. An individual, the principal, was the only one who had been trained supposedly how to run a building and what subject matter and etc. And they didn't always have that right, was trained to do this, but yet they had this collective unit of how to run a school. That was a group of people that was leading a school system blindly, or that particular school. John Buchanan, you were there during that process. Do you remember what that committee was called?
It was decentralization, and it was horrible, horrible. What ended up, what they ended up doing was the principal had all the power to hire and fire and do whatever. Maybe, I don't know if that advisory board, advised them, but the principal was given the power. Whereas prior to that, central administration made sure that every school got supplies, every school got faculty and staff, every school got the structural support for the building, the maintenance, the custodial staff, the dining hall. I mean, everything was equal across the system. When those principals got power, and this is a little bit off subject, but when the principals got the power, they could do whatever they wanted to do. And they started hiring all these reading and math teachers and eliminating band and choir and drama club and, art teachers and even physical ed, because all their pay was based on reading and math scores. They didn't realize that the band makes the school run, and the choir and the drama club, makes the school spirit, effective. It supports everything. So that's my take on it. Sorry about that.
Thank you. Thank you for sharing. Any other comments?
That group that Carol's talking about is called the LSRT, Local School Advisory Board.
Okay.
My one take on it is, I'm glad I'm 80 and I went to school back then. That's when we had to pray before we started class.
Yeah,
We
remember
had to
those
give
days,
the
huh?
flag salute before we started our lessons.
Yes.
I
Yes.
feel for I felt even for my children, but I really feel for grandchildren and great-grandchildren.
Okay, well, let's move on to the next. I think we had an adequate discussion of the multiple aspects of it. This is just to inform you that they did do a successful stem cell transplant for type 1 diabetes, in which they used the patient's own islets, which was novel because you would think that somebody who has type 1 diabetes wouldn't have islet cells, because as a matter of fact, the diagnosis of type 1 diabetes is that you don't have functional islet cells. But they were able to take this person's islet cells that they did have and modify them so that they could produce islets that would make insulin. And they actually did this successfully. And 75 days after transplantation, the patient was able to be off of insulin. So it's going to be interesting to see how this all works. Now, this particular patient already had a liver transplant, so they were already immunosuppressed. So it's a unique circumstance, but it's just to report that this has been done successfully. Whether this will be the one and only one, or whether this will be tried again and will be a model for future transplants, I don't know. But I just wanted to share the fact that this has been done successfully. This is a study that we talked about last week, in which they had a new approach in London, in which they would use the three drugs for management of hypertension, but use small doses of each, so you wouldn't have side effects from any of the medications. And in London, it was effective, but the question is, effective for what category of patients? And will that be something that will work with people of color or not? And this so-called Veronica trial is something that time will tell. But it's attractive in the sense that you don't have the side effects that each of the drugs would have if they used the more potent levels. As we know, many of the antihypertensive drugs have side effects of decreasing the ability to have erection for men, the ability to have sex libido, and then also many other side effects. So the theory is that having a small dose of a lot of the medications will allow you to eliminate the side effects. Whether this is going to work or not is going to be interesting to behold, but it's a new type of treatment for high blood pressure, which is one of the biggest killers of mankind. Any thoughts on this brand new concept of a little of each drug without a whole lot of one or the other. So we just have to wait and see what happens and see how patients tolerate it. Because a number of patients in each of the drugs, when you go to the top dose, they have side effects and they have to stop the drug or they have to decrease the dose. As some of you have already stated, you put on medications where your doctor had to decrease the dose to allow you to safely use the medication. So this is the concept that is, we already know that a lower blood pressure gives you a better outcome. And so that's the goal. We also know that in spite of people being on antihypertensive, the death rate from cardiovascular disease has not changed over time. So it means that we aren't doing it right because the patients still aren't taking the medications. Most of the patients we find who are hypertensive as we screen patients are patients who are already on blood pressure medicines, but they're not taking them. Dr. Perez.
I just wanted to know the diversity, agenda diversity of the principal investigators, given that one of the outcomes for success was increased libido in men.
Yeah, of course. As a matter of fact, in the early days of hypertension, that was one of the biggest reasons why men stopped taking the antihypertensive medications. Not decreased libido, but inability to have an erection. Any other comment, Dr. Perez?
No, that's it.
Okay.
Diversity and inclusion.
Say again.
She said equity and inclusion.
Oh, okay. All right.
I had a thought. If you're going to have those 4 medications, I mean, right now I'm taking a bunch of medications anyway, 2 for hypertension. Is there a possibility of combining them into one pill?
Well, first you have to find out if it works. If it works, yeah, they can do that. As a matter of fact, we have many pills that are a combination of 2 or 3 drugs. So yes, they can do that if it works. First, you have to prove that it works.
They can put it in a capsule.
Yeah, they do that already. Right.
Okay.
Dr. Perez?
No more comment. I'll lower my hand.
Oh, okay. Okay, next article then. Wow, I didn't realize it's already 10:30. So this will be the last article, I guess. This is interesting that this article talks about people of color who are transplant recipients also can get skin cancer. Because for the most part, the commonest cancer after transplantation is skin cancer. But because blacks have less skin cancer than whites, we tend not to emphasize this in transplant patients who are of color. And this article says that they should be concerned about it as well. And they should wear sunscreens as well as others. So this is probably the first article I've ever read that actually addresses people of color with skin cancer, because skin cancer is the commonest cancer of transplant patients. Okay, this has been the last article. Any comments about it?
I had a question, Dr. Callender. How does skin cancer manifest itself?
Say, how does it manifest? Oh, you have
Lesions.
You get lumps and bumps or ulcers, any lesion on the skin that wasn't there before is something that may need to be biopsied to be proved that it's not a cancer. But it usually manifests itself by having a bump or a lump or an ulcer or growth in the skin that wasn't there before. And one of the things, of course, with people who are white, you can see the skin lesion much more easily, whereas people of color, you may not be able to see it as well because the complexion may hide it. But there would be a growth that wasn't there before, and there would be an ulcer that wasn't there before. But it would be more easy to miss in a person of color.
Do we still have instances of leprosy nowadays, or do they have leprosy pretty much under control?
Leprosy is pretty much under control, but leprosy still exists.
Thank you.
Okay, thank you for your attention. Time really flies when we have such great discussions of so many different subjects, and it's good to have you all. I see Lynette is with us again today, and it's good to have you, Lynette. And I saw Fred West was with us for a while as well. So it's good to have all of you. And any comments before we close?
I've got one quick question. We're talking about formulated drugs, where several drugs can be combined in a capsule. Most of those capsules are gelatin, which is a pork derivative. Do you know if they offer vegetarian capsules when they're formulating drugs?
I don't have no idea. That's because I guess we'll have to research that because I have no idea how to answer that question as to the types of way they've packaged the drug. So we'll have to look up the pharmacology.
I know the vegetarian capsules are available. I'm just wondering if they have them in supply at pharmacies. But yeah, I'll try to research that as well.
Okay, I appreciate it. Yeah. Okay. All right. Have a good week. This October, we only got 3 more months in this year. Time is flying. Oh, here's Lynette. Hi, Lynette. How are you? Nice to see you. Glad you could join us today. Yeah. Were you able to appreciate some of the differences of opinion that many of us have about everything? Well, that's one of the delights of this group, is that we have a diversity of opinions, and we also are able to admit what we know and what we don't know, and what we have opinions on. So thanks for joining us, and continue to join us. Okay. All right. See you guys next week.
I got one announcement.
Okay.
Next Tuesday, I get an honorary doctor's degrey in Wilmington, Delaware.
No.
Wonderful. Wonderful. Hey, why don't you send us something about that so we can be knowledgeable?
Oh,
Dr.
okay.
Tatum.
No.
That's what an honorary doctor is?
I'm not even going to share my thoughts about that because my family has chastised me greatly. So I'm receiving it graciously, like they told me to do. But yeah, I'll send information. I'll send it to John Buchanan or to
Okay.
John.
All right. Good. Yeah. Congratulations. Congratulations.
Okay. It'll be fun again. Okay.
A doctorate in sacred music.
That's just what I was getting ready to ask.
Mom, they said congratulations. Your proper response was supposed to be thank you.
Oh, thank you.
That's what she told me. Yeah. That's what she told me many years ago. Right.
Yeah.
Oh,
Her family is taking that really seriously, and she's taking it like a grain of salt.
That's great.
Well, that's a great honor.
Be sure,
That's
Graduate.
why
be
it's
sure you
called,
raise your.
that's why it's called an
Be sure.
honorary degree, because it's an
Yeah.
honor.
So,
Right.
Now you can ask for twice the money at the churches you support.
Amen.
Ah,
Okay, see you guys next week, God willing.
All right. See ya.
God bless.
Thank you.
Yeah.